All right, on to another question. So here, again, we're going to go ahead and read the last question or the main question. The serum concentration of which of the following is most likely increased in this patient? So serum concentration is increased. Okay. Sometimes they'll trick you and sometimes they'll say decreased. So make sure that you actually read through the question. I've made that mistake a couple times. So here again, a 62-year-old man, important, comes to the physician because of burning pain and tenderness of his right great toe for 1 day after heavy ethanol consumption. Physical exam shows erythema, swelling, warmth, and tenderness of the right great toe after a 2-week course of the NSAID. His symptoms decrease in severity but do not completely resolve. The serum concentration of which of the following is mostly increased in this patient? Okay, so here the first main thing that I would do in this question is go ahead and figure out the diagnosis. Obviously, you have to consider some other diagnoses, but this question stem is really heavily pointing to gout. It is a 60-year-old man, which is both risk factors of gout, and the symptoms point to gout, and he's also coming after heavy alcohol consumption. The NSAIDs do help the pain, but do not completely resolve the pain. So there are some other treatments for gout that could be better in efficacy. So I'm going to go ahead and lock in that this is my diagnosis. So now you have to go and decide what is the buildup product in gout. And again, we go through here. Carotene, no. Iron is more hemochromatosis. So I can mark out some obvious ones that I know it's not. And based on the other treatments for gout, that if you know colchicine, raspbericase, some of the other treatments for gout, allopurinol, you know that they all resolve around uric acid. Uric acid builds up in gout. So this one, it is important to go ahead and decide what the diagnosis is, and then decide the mechanism of that diagnosis that treatment options, different pharmacological agents can target to help treat this condition. That one was a little bit more straightforward, especially because gout is very heavily explained here in the very stereotypical fashion. So I hope that was at least a little bit helpful.